Hello, Dr. James Bogash, publisher of Modern Health Myths, and today we're going to go over some new research on COVID spread so that I can get it to you before everybody else puts it in the media and causes a panic. This has been a discussion about how far the virus can spread for a long time. The whole idea of 6-foot social distancing, quite frankly, was probably a dartboard decision. Not a whole lot of research on that point, and but clearly you can't really argue that social distancing is an effective method of preventing the spread of anything. If you stay locked in a cave, it's going to stop whatever it is from getting to the next person until, of course, you come out of the cave, which creates its own set of problems. We're starting to see that across states, across the globe, that as people start to emerge from their collective caves, that numbers start to go up. That is expected. By now, if you don't realize that coronavirus COVID-19 is not going away, then I'm not entirely sure what I can tell you that's going to enlighten you or change your mind. But how far things will spread has always been a concern, and quite frankly, more of a fear than anybody else. The idea that you could be walking by somebody in the grocery store and they could breathe, and you'll walk by an hour later and catch COVID-19. Now, that is, well, I've heard that said, it is absolutely ridiculous that that would actually happen. So we really need to be in relatively close proximity to somebody who is more than breathing, more likely coughing, because that is going to kick out a lot more viruses. But how far can a virus spread if somebody is coughing and is positive for COVID-19? So that's what researchers put together, a tricky little experiment to figure this out, and they had 2 positive COVID patients in a hospital room, and they put together a relatively ingenious contraption to capture droplets. So because a lot of times viruses will travel on droplets. Normally they only go a few feet and drop down. It depends a lot on humidity. It depends a lot on airflow, circulation. Those are all things that can dramatically change the likelihood of somebody spreading or catching COVID-19. So what was interesting, this was one of the first groups that looked at not just the viral materials, because just because you can find a RNA from coronavirus 3 weeks later or 20 feet away doesn't mean that you can swab that, stick it up in the back of your nose, and develop COVID-19. That's not how it works. Keep in mind that just because we find select sections of RNA does not mean that that is a viable virus that can actually cause an infection in somebody. That may only recognize a small chunk when it requires a larger chunk of the virus. So this was the first group to actually do something creative, in that when they captured these aerosols, and some of the farthest were their collected devices were as far as 16 feet away from the patients, they were then able to take these segments and put them in a culture medium. So basically a solution that would allow the virus to grow, and they were able to reproduce the virus. So this is different than finding DNA material or RNA material or genetic material 16 feet on the floor. This is actually finding material that can then reproduce and produce COVID. So before we panic, there's a couple things I need to say. Is this article first came out in CNN or one of the major news outlets, and as always, anytime I see something, I'm going to go to the original research, which of course I will post in the comments. But they talked about, they used, and this is why you can't follow mainstream media, they talked about a live virus, which, if you understand viruses, essentially that doesn't make any sense. Viruses aren't alive. They're essentially just snippets of codes, they're messages, and then they invade our cells and they use our cells' own machinery to create problems. So viruses in and of themselves aren't live. They're not sentient. They're not aware. They don't, look out for people and attack. So when you see the news reports saying something like a live virus, I kind of think that's really designed for sensationalism and not reality. But the real question with this is, okay, so we have 16 feet away from sick, coughing patients who were kicking out the virus at much larger numbers. So this isn't walking by somebody in the grocery store. This isn't walking by a asymptomatic person. This is a person who's coughing and ill with COVID. Somebody who we know we need to protect from, and they need to protect themselves so that they don't spread it. So keep that in mind, that is an unusual scenario, and a scenario that's very well highlighted that we need to protect from and against. But then the other question, and this is where the discussion comes in, is the researchers gave a density essentially of how much viral material was found 16 feet away. And the discussion then becomes, is this enough viral material to cause an infection? And none of that takes into account your own ability to resist an infection. Just because we're exposed to the virus does not mean we're going to catch it. I don't know, I don't think the average person understands that, but how else can a household of 5 only have one person who tests positive and gets sick, and everybody else does not test positive? There's no way those households aren't exposed to the virus, but they obviously did not become ill or even test positive because their body fought it off. So when you see this study, and people start to quote it, don't panic. Just because we can find the viral material at a relatively low concentration 16 feet away from somebody who's coughing does not mean that A, the concentration is enough, because we have to have a certain amount of viral material to create an infection. So A, do we have enough viral material? That hasn't been determined. And B, we always forget about our own personal susceptibility and supporting our immune system so that we're not getting sick. So if we do happen to be in that exposure range, that we're not going to be sick, which is very clear that that can actually happen. So don't let anybody else tell you otherwise. Otherwise, we wouldn't have a household where only one person tests positive when we know that everybody is exposed. So, as always, welcome comments, and make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.